So role pediatric registrar, setting outpatient clinic in busy district general hospital. You're talking to Mr. and Mrs. Hope, a parent of 3-year-old Lily. Lily is a 3-year-old girl who was recently admitted to the ward with a new diagnosis of insulin-dependent diabetes mellitus. She initially required insulin and fluids intravenously, but has now discharged home on subcutaneous insulin 4 times a day. Her parents are managing very well and have met the diabetes team, including the consultant, the dietitian, and the children's specialist diabetic nurse. As a part of education package that has been developed of newly diagnosed diabetes, Lily's parents will be attending clinic today to learn about pathophysiology of diabetes. This is to aid their understanding of their daughter's condition. Okay. They are attending the clinic today to learn about pathophysiology of diabetes. Please discuss the pathophysiology of insulin-dependent diabetes with Lily's parents. Points to consider: ask how Lily is doing, ask how they are doing, acknowledge that it must be have a shock for them and it's a difficult diagnosis to understand. Set the scene for today's. You want to try to explain some of the theory behind diabetes, which will hopefully help the parents to understand Lily's condition more easily. Invite them to ask questions at any time. There is a lot of information that you could give them now. Practice this so that you have an explanation which you can easily provide for non-medics. Start off by explaining the physiology of glucose homeostasis, that is, blood glucose levels are tightly controlled by a balance between food intake and insulin release. Okay. The commonest cause of diabetes in childhood is type 1 autoimmune diabetes. Give basic explanation of the term autoimmune. Annual incidence of the condition is 20 per 10,000 per 1 lakh children, and it is increasing. Diabetes is a metabolic disorder due to disturbance of insulin function. Explain about the insulin, that is actions of insulin. Autoimmune destruction of beta cells of pancreas leads to deficiency of insulin secretion. Break this information down and explain it using a diagram to help. Clinical efforts of low insulin levels, including the effects on liver, muscle, and adipose tissue. Okay. Complications: diabetic ketoacidosis, nephropathy, retinopathy, and neuropathy. Keep on checking parents' understanding and provide written information and offer a follow-up appointment. This is your task, and I will give you 2 minutes, 3 minutes from now, no problem. But you want to draw? I will share the screen.
Yes, I want to draw.
Whatever you want to draw before time, because at that time you will not have time to draw.
Yeah, we can start in 1 minute. Okay, I will draw now.
Yeah, draw it. If you are ready, we can start. For me, no problem.
Yeah.
Okay. I have muted you. If you want, if you're ready, tell me.
Hello. Yeah, I'm ready.
1 minute. What were the names? Mrs. and Mrs. Hope, right?
Yes,
And Lily.
Hope. Yeah, Lily is the child. Yeah.
Mrs. Hope. Okay, you can start.
Good evening.
Good evening, doctor.
I'm Dr. Sridevi, one of the child doctor here. I believe I'm talking to Mr. and Mrs. Hope, parents of Lily.
Yes, doctor. It's me. Hello.
Nice to meet you and thank you for coming here. Hello.
Hello.
Is it audible?
Yeah, audible. Go ahead. Yes, doctor.
Hello.
Thank you.
Okay. Okay. So how are you and how is Lily now?
Lily is fine, doctor. After the treatment, Lily is fine, but I have some concerns regarding her condition.
Yes, actually we are here today to discuss about Lily's condition, that is about pathophysiology of diabetes. Okay.
Okay.
So before I start, do you want anyone else to attend?
No, doctor. Actually, all are busy. I am alone here. You can go ahead.
Okay. So can you tell me, Mrs. Hope, like what have been discussed with you regarding Lily's condition till now?
Actually, they said that Lily has diabetes. They explained to me what is diabetes. They told that a condition in children's body where they will have more sugar. The sugar will be raised, and this is because of protein in the body called hormones. They also told me, like insulin. This is what I know, but I don't know why this happened with Lily.
Yes. Yeah, I know it's like shocking for you to know about the diagnosis about the Lily. I will just explain you what is this diabetes and why Lily is affected. Okay.
Yes.
So in diabetes, yeah, what happens is in our body, we need calories and for that we eat food, right?
Yes.
So from the food, yeah, from the food, the sugar which is released, this has to be utilized. So you can see the picture. This is the blood tube. So once the food is released into the blood tube, it has to be utilized in the body with the help of a chemical substance called insulin.
Okay, doctor.
Okay. So what happening in Lily condition is there is because there is some problem in that gland, the insulin is very low in her body.
Okay. Yeah.
Am I clear so far? Yeah.
Yes, doctor. Now, why you said problem in the gland? Can you explain me what does it mean?
Yeah, actually there is a leaf-like structure in our body, in our tummy, okay, which produces this insulin, okay, that is called pancreas.
Okay, doctor. Okay.
Okay. So what is happening is normally in our body, our defense system, it works against the bugs which cause infection. Okay.
Yes.
In this Lily's condition, what happened is this defense system is acting against her own body tissues.
Okay. So this has caused the problem in this leaf-like structure?
Yes. So it has caused, like, it is damaging these this structure, this gland, and that's why she don't have enough insulin in her body.
Oh, okay, doctor. But I want to tell you, since it's damaging this one structure, it can damage other structures in the body also, right? The defense mechanism. So Lily may have more problems.
Yes, Mrs. Hope, you are right. It is possible. It's not like immediately she will have some other issues recently, but we will be in close follow-up, okay? And we'll be monitoring her if he develops any problem like that.
Oh, okay, doctor.
Okay.
Now I want to ask, is Lily's body, this gland, what you were telling, it's not at all producing insulin? She doesn't have even little insulin in her body?
Yeah, actually, when it gets destroyed, like maximum destruction, almost like more than 90% destruction, then only they present with these symptoms of high sugar, like she presented. Okay.
Okay.
So,
So
yeah,
that means she may be producing, but very little.
very little, but in the due course, unfortunately, maybe she may not have that much also.
Okay. So
Yeah.
other than insulin, there is no alternative treatment for her.
No, I can understand that you are worried and about her. Yes, actually, there is no alternative. Only insulin, which is the medication which we can give in these conditions.
I was thinking, doctor, maybe after a few days, I will stop insulin and I will start some medication for her. This is really making me feel bad.
I know it's really difficult for you to go through all this. But I can reassure you that she is doing well, okay? And once she is habituated with these injections, she will lead totally normal life.
Okay.
Okay.
Okay, but she needs to take so many injections and we have to take care of her. So this
Yes.
insulin and this blood sugar, because it is high in her body, what else can it cause, doctor? What else can it cause to my baby?
Yeah, actually, what happens when they have this diabetes, there are two things. One is like for high sugar, we have to give insulin. Also, we have to monitor very frequently this insulin.
3 minutes left. Okay, 3 minutes left.
Okay. Yeah, we need to monitor very frequently about her sugar level, because high sugar and low sugar is both are not good for Lily. If it is high sugar, it can cause, like, so in the body there is production of acid, and it will lead to affecting the brain also. Okay, sometimes they present with like severe tummy pain. They can present with like unconscious state. So this condition happens if it is not controlled well. Okay, so
Okay, then
these
I
are
have
the
to be
dangers
very
signs what
careful,
I'm
doctor. Then
explaining.
I have to be very careful.
Yes.
I was not knowing much about all these things, really, about the problems.
Yeah. This is about if it is not under control. But even over control means if she is like no food she is taking less and insulin is high, then she also has the low sugar levels.
Oh,
Even that will affect her.
oh, then I have to keep on checking her blood sugar now and then, doctor.
Yes, you are right. So initially, till her diabetes under control, we have to check very regularly blood sugars. Okay, and you have to follow up with all your team members, like where you are following now, the gland doctor, dietitian, pediatrician. It's very, very important. Okay.
Okay. What else it can cause, doctor, apart from
But
this?
other than that, like I told, the low sugar, in that case, they will become very dizzy. She will have so much of sweating. Okay.
Okay.
So the gland doctor and the team diabetic nurse, she will provide you the kit. In these cases, there will be some like no gel type of things. Either you can give some those things, or if she is accepting orally, then you can give some juice like apple juice in that condition.
Okay. The
Okay.
doctor last time he was telling it will affect the eye, it will affect the kidney. I am worried, doctor. She's just 3 years old. Does this condition will affect all? Like he was telling it will affect eye, it will affect kidney. Can you tell me about it?
Yeah, I can understand, Mrs. Hope, that it's like no very like no, it's shocking for you and understand these things. It's really difficult condition. They can have long long-term complications and all. Okay. So what we will do is, I will again arrange another meeting so that we can take up all these questions. Is that okay for you?
Yes, doctor, no problem. We can arrange one more meeting.
Okay. So can you please, can I summarize for you what we have discussed till now?
Yes.
Okay, so we discussed about the Lily's condition, that she is having diabetes because of the lack of insulin and why it has happened. And also we discussed about what complications they can have and what is the importance of monitoring. Okay, so what I will do is I will give some leaflets and some trusted website, and also like I will arrange another meeting so that I can take up all your questions. Okay.
Okay.
Okay, Mrs.
Okay, time finish, huh?
Thank you.
Okay, thank you.
I don't know whether I should jump like that or not.
No, it's okay. Actually, sometimes, in Jeddah and all, they are continuously asking questions till the last. So I don't know. It's a good trial, but because this answer will not finish in your time, I have to explain about the eye kidney. It's okay. You told that you will arrange one more meeting. I think it's okay to answer all her concerns. But it went well. But in the starting, even though the task I told you pathophysiology of this, don't tell this to mother that I am here to explain pathophysiology. Because if you tell pathophysiology, immediately you have to tell the meaning of it, but which you did not do.
Yes.
Like when you just 2 minutes, and
Yeah.
for me, if you tell that I am here to explain pathophysiology, immediately you should explain what is pathophysiology. Like you would have told her,
Yes.
physiology means I will explain you why this condition happens and how this happens, what is the cause of it, like this. Or just you can tell her that I am here to explain about why this condition happens, what happens in the body, for this reduction. She told you that she knows about hormone insulin. She already told you. That means she knows insulin.
Yes.
So insulin will no more be a jargon. You can tell her that why this insulin is produced less in your body. This is what I want to explain you. This is what is the pathophysiology, right? You want to explain why this is happening. So I don't use the word even though it is given in the task, or if you use, immediately explain. This you did not do. Otherwise, I think you told chemical substance, which is an alternate for hormone, or even you can say protein, because all hormones are proteins. Then you told bugs, and I don't know your answer. It was correct, I think, right? No insulin is produced. That means the children will present only if more than
It is.
Yeah.
It's almost lost, almost like last 10%, 5-10% left only, they will present that time.
Okay. So, okay, it's a good point that more than 90% of the pancreas is distracted. That's why. And you told very nicely for this, our autoimmune, you explained as our defense mechanism. So my question was, it will affect other parts of the body. I was targeting for the other autoimmune diseases.
Yeah, that's why I told it can be affected, and we'll keep a close eye on it and we'll monitor for that.
Yeah.
Because if I go into that, I will lose my task.
Yeah, right. You did a great job there also. Only this thing. And gland, I think gland is not jargon, right? Because we say gland doctor. And you told this leaf-shaped gland, I just draw because for her to understand. We can just say that there is a, as you said, leaf-shaped gland in our body in the tummy, which produces insulin. And it has some, most of the part of it is destroyed by our own defense mechanism. What we can use the word destroyed, or what else we can use? Affected,
Yeah,
or
we
what?
can use it. Affected or destroyed, I think both fine.
Okay, or
These are
even
all
affected also, no problem. Okay, these are all normal words. I think only pathophysiology was my comment. And if anyone has noticed anything, please give the comments for this scenario. Because in some cases, pathophysiology can come. I think in one of the JIDDA exam, they had asked the pathophysiology of dengue fever.
yeah, why there is thrombocytopenia and why there is why don't they give platelet transfusion, something like this.
Yeah, again here the same reason, right? Our own body defense mechanism is destroying it more than the virus itself. But the trigger for this is the viral infection. But the trigger for this defense mechanism to become active is the viral infection. This is what we have to tell. If you know,
You are
just
sure about the viral infection, or just enough to tell it's not non-cause, no specific cause?
no, not here. I am talking about dengue fever, dengue.
Sorry.
Yeah, not here. I was talking about the dengue fever. There is in one JIDDA exam, pathophysiology of the thrombocytopenia in dengue fever, I think. I'm not sure. It was asked.
Yeah, it was the case. It was in Egypt.
No, even in JIDDA it was there.
Oh, okay.
Okay. So if anyone knows, tell, because we remembered. Anyone knows about the dengue fever pathophysiology?
Actually, their activation of this immune system, and there is like mainly in leakage happens, right?
Yeah.
There will be plasma leakage. That's why this dengue shock syndrome and all associated.
Yeah.
The question was about pathophysiology of thrombocytopenia. So there is all hypotheses which have been given. And there are 2 to 3 hypotheses. The one of them is autoimmunity. However, there are other ones in which the virus directly acts the bone marrow, causes bone marrow suppression. Every time we see that the thrombocytopenia generally occurs in the reinfection phase of dengue. So that gives the pathophysiology of autoimmunity, that the first dengue infection has actually led to antibodies, which are even acting against especially the antibodies which act against the NS1 antigen. They even start breaking. This NS1 antigen is a little similar to the platelet antigens that are present. I don't remember which antigen on the platelet is similar to this, but it is similar. So basically, because of this autoimmunity, there is killing of the platelets. The third hypothesis is cytokine activation, that there is a lot of cytokine activation that is taking place because of the dengue, which this release of cytokine is causing this thrombocytopenia. I don't think so details are required. Just naming these 3 to 4 pathophysiology is enough to the medical student.
Yeah. That's what one of the pathophysiology here is the autoimmune. Another, you said the virus itself depressing the bone marrow suppression. Okay. Another was the
third I told you, cytokine activation. Yeah. I'll just send a message, but this is once again all a hypothesis. I've still not got the real mechanism,
Yeah.
Even there is increased platelet destruction in, like you told, like decreased bone marrow suppression, and also increased destruction of the platelets.
Yeah, destruction because of the antibodies that the first infection produces. They're already running when in the second infection. There is some DENV1, DENV2 also, and antibodies. So they are the ones which start killing the platelets. I'm so sorry.
Yeah, that is the main pathophysiology, not only like the thrombocytopenia, even for the dengue disease to present, that is the pathophysiology. It is the second infection which will cause the symptoms.
Yeah, that is causing the shock. That is because
Yeah.
the same antibodies not only destroy the platelets, they even destroy the endothelium. So there is plasma leakage. They even destroy the clotting factors. So there is a coagulopathy kind of a picture, hemorrhagic thing. So these three places they act, these antibodies.
Okay. So these were the questions I was just asking about the complications. Diabetic ketoacidosis, you explained, nephropathy, retinopathy, and neuropathy. You said you will arrange the next meeting. Okay. But good, you told about the hypoglycemia also, which is more important. And I think in one place, you did not tell anything about the empathy or sympathy in one place, I remember. So always, no problem. Even if you give less information, no problem. When she says something, oh, doctor, I'm too much worried, tell her something and then tell your thing, whatever.
Yeah.
Dr. Muzna, you are free now? Hello?
Yes, Dr. Noor.
You are free now?
Yes, tell me.
You want to do the second scenario if you are free?
Okay, fine.
I am just doing from the Rebecca. I just now started. One she did, second
Okay.
you will do, and next we will start tomorrow. Because this is also very important, you know, if we know the Rebecca, any scenario comes, we can handle it. So I will just read the scenario for you.